So it's that time of the month where I take laboratory calls. As a clinical microbiologist, my job is in twofold. I see patients on the ward, patients that have infections, okay, and then I also supervise laboratory duties or laboratory processing of specimens. So today I'm on call and I'm going to be processing some urine specimens, and I want to use the opportunity to enlighten you about what we do on this side of the hospital. So these urine specimens have been requested by doctors who think that their patients have what is called urinary tract infection. Urinary tract infection is a condition wherein there is bacteria in the urinary tract, and that is causing certain symptoms, causing certain discomfort to the patient. So the doctors have sent these samples because they want to know what bacteria is causing the infection and what antibiotics will be best to treat this kind of patients. So urinary tract infections they are conditions when there is bacteria, presence of bacteria in the urinary tract. That particularly means the bladder and sometimes the kidneys. When the infection is located in the bladder, we call it cystitis or lower urinary tract infection. When the infection is in the kidneys, we call it pyelonephritis or upper urinary tract infection. What are the symptoms that the person could have when they have urinary tract infections? A person could have dysuria. Dysuria means painful urination. When you're peeing, when you're passing urine, you feel some pain as urine is coming out. A patient could also have frequency. Frequency is that the rate at which you urinate has increased. That is, let's say on a normal day you urinate about 3 or 4 times in a day, and then you suddenly realize that has increased to about 8, 9 times. Okay, it could be a pointer that you're having a urinary tract infection. Then there could also be urgency. Urgency is that the person feels they have to urinate and then they feel that they have to go now, like they cannot hold it. Then sometimes it can also be hematuria. Hematuria means that there is presence of blood in the urine. Now when you look at this particular specimen, you look at it, you find out that okay, the color is obviously different from those other ones. That of course, that doesn't mean the other colors are normal. These are about close to the normal urine color. This on this other side appears cloudy. Okay, but without even processing, I can almost bet you that this urine is infected because the color is so deep and it's cloudy. So I can almost say that okay, there's an infection going on there. But when you look at this particular one, you realize that the color is a bit reddish. Okay, so it's likely that person is having hematuria. There's blood in that urine. So sometimes when there's blood in the urine, it may also be a pointer to the fact that there's a urinary tract infection. There's sometimes when it appears cloudy, when your urine is cloudy or it's not clear, like this should be the normal color of urine, very clear, slightly yellowish in color. That's the normal color that urine should appear in. That's the normal color that urine should come with. So when patients have symptoms like that, it could be a pointer that they have urinary tract infection. Now the thing about infection is that, particularly for doctors, we don't want to keep doing guesswork. Even though sometimes, depending on the severity of infection, we want to start what is called empirical antibiotics, which is just okay. We think that the patient has an infection and sometimes it may take about 3 days before results will be out, and if we don't want that infection to spread, so we would start what is called empiric antibiotics, which is more or less like guesswork. But while you are on that empiric antibiotics, then the doctor is going to ask you to go to the lab and run a urine test. So you are going to submit urine specimen to us like this, and then we will process in the lab. And then the ultimate essence of this processing is that we want to know what bacteria is causing this urinary tract infection. And then aside from that, we want to know which antibiotics will be most useful or will most suitable to treat that particular infection so that the patient can get better. Now, for those of you who are at home, it is important that when you have symptoms of UTI, you don't want to self-treat, all right? Or you don't want to take antibiotics at random. You really want to go to the lab, do a proper diagnostic test, and let's be sure what antibiotics to treat you with. Because if you keep using antibiotics or you use antibiotics when you're not sure of your diagnosis, one of the things that you could predispose yourself to is antibiotic resistance. Okay, when you take antibiotics indiscriminately, you take antibiotics when they are not needed, or you take the wrong set of antibiotics, okay, it can make bacteria around you or in your body to become resistant, such that when you critically need antibiotics, the antibiotics no longer work. So if you are feeling symptoms, you don't want to just go to a chemist and just say, oh, give me a drug. You want to see a doctor, okay, and after seeing a doctor, the doctor is going to recommend a test. Go to the lab, run the test. When your result is out, then we know the best antibiotic to treat you. And of course, it's also important to also say that anytime you need to take antibiotics for any infections at all, you want to ensure that you complete the dose. You know, the way antibiotics work is that, let's say, for example, somebody has urinary tract infection and we start the person on antibiotics. Usually we'll say 5 days, the person take that antibiotic 5 days or 7 days. Okay. Now, by day 3, most likely by the second day, the third day, you're likely going to feel better because the antibiotics have started working. It has started eliminating the bacteria in your system. Now, most people assume that because they feel better, then that means they are truly okay, and then they stop the antibiotics. Now, it doesn't work that way. If you do that, what you're doing is that you are predisposing yourself to antibiotic resistance. Because yes, you might have felt better symptomatically, but the organism may still be in your body. They will still have remnants. Okay, let's say you have 100, just for example, just for analogy. Let's say you have 100 bacteria infecting you or affecting you, okay, causing urinary tract infection, and then you take antibiotics, and then you are able to kill, let's say 60%, 70%, let's even say 80% of them, let's even say 90% of them. You're able to kill them by day 3 or thereabout, and then you feel that because you are okay, you stop taking your antibiotics. What you don't understand is that the remaining 10%, okay, because the antibiotics has not killed them, all right, so they've gotten exposed without antibiotics, all right, but they've not died, so they develop what is called resistance. Okay, they modify their biology so that antibiotics becomes useless against them next time. So when you're treating any infections at all, UTI or any other infections in the body, you want to ensure that you take your antibiotics completely. And of course, if you are even having any symptoms, you want to ensure that you see a doctor and then let your doctor recommend appropriate tests. And after the test, take your medications as prescribed and complete the dose. All right. Bye for now. See you soon.